The word of dentistry and implant dentistry that we don't have to refer to these two big human beings. That is the first one who received implants, Gustav Larsson, and of course Professor Branemark, that the first implant studies in live bone was performed in a dog. And of course refer also to the mythical meeting of Toronto in 1985, where the osseointegration was accepted to the world. Unfortunately for that date, it was also the birth of a dogma. What is a dogma? It's something essential point which cannot be doubted. We live under that dogma for a long time. What was about the dogma? The dogma was about specific points of implant installation, time to wait for the healing of the bone, and time to use that implant in terms of rehabilitation. Today, we all know that that dogma is falling down, except for the points that we should do it in an aseptic environment and under control of temperature. Because, as Meyer said before, we are doing mechanical things in biological environments, and the bone is very sensitive to temperature. It's very interesting to refer to the vintage studies, because from the past we may notice where we go in the future. It's amazing to see and to create a brainstorming session to understand which is the best implant, and we will take like one day discussing which is the best implant. But for some reason we forgot that sometimes we may say that for this case it will be magic, or it will be a Branemark, or it will be a Strongman, it will be bone level, it will be under level, or whatever. Sometimes we don't need the implants. Sometimes we could fix this with the standard dentistry, with the adhesive dentistry, and it will take more than the time that we expect. So we have to be careful. And this is the way that the people, the big professors are asking today, where to go. We should preserve the teeth, or we should install implants, Lang and Vienna. But look at the keywords. The keyword says peri-implantitis, oral implants, implant dentistry, periodontitis, tooth maintenance, and function. What happened to the correct implant insertion? Maybe the most important topic in the therapy is to install the implant in the right place, in the right way, and in the right protocol. Taking care about the temperature and all the aspects that we all know, that this is a surface phenomenon that is preserved by the blood supply. So in 1989 it came the second dogma. It was novum. Unfortunately, it doesn't have the luck that the first dogma, and it disappeared very quick. And the third dogma came by the hand of the University of Leuven, that is called Lithoring, the digital way to install implants. So, where we are now, where we are stand now, we are in the fourth industrial revolution that is led by the digitalization. Moore's law says that every year we have the double of power by the half of price. So why go guided? Which is the main reason to go guided? Two social reasons. We are getting older and older and older and more active. And now, the human being born digital. So, if we cross this information with the adulthoodness, like in the Americas, a developed country, 58% of the population over 65 years is completely adulterous. And the growth of the population in the world, and of course the expectancy of life, we will have for the 2025, more than 1.2 billion people in the world without teeth. So we need a reliable solution, a trust solution, very easy to understand, safe for the bone, economic, and quick. Which is the guided concept? The guided concept, first of all, is diagnosis. Diagnosis is the first part of the guided concept. After that, it's planning. Once you are making the diagnosis and the planning, then you can go to the next step, that is the surgery. And at the end, if you're available, and if you can do it, you can go for the prosthesis. Then you have all the steps of the prosthesis. That could be temporary, definitive, or whatever you want. It's up to you, it's your criteria. It doesn't come from the industry. But never thought that because you are doing digital, you will start doing this. No, because the digital world is just a tool. It's not an imposition of nothing. So let's see a case from almost 11 years. Our starting with this was with Nobel Guide from the House of Nobel Biocare. And we were able to start seeing where will we finish. And then we can perform the surgery, as you may see here, without flap. It means flapless, knowing exactly where we'll be ending. But you may say, I've been seeing this for a long time and without so many successful cases. The problem is that the marketing part of this system were related to anybody, and anybody can do this. This should be done by someone trained. So education in guided procedure is very important. Because it has some limitations that we have to know how to handle and how to fix it. So, after so many years, we have a patient with 85 years old, and we can realize some things that in the classic dentistry we are not able to see. That is the parafunction. And if we decide the right material, which in my opinion is not the ceramic, is related to the acrylics, we will be able to see that the people can have his denture for a long time. More time that sometimes we guess with implant dentistry. Like in this case with more than 11 years. Because at the end of the day, as Mayer says, we need to restore people's life more than maxillar, more than bone, more than just thinking implants and tooth or teeth. We are in the field of medicine, we are in the field of psychology, we are in the field of recover people's life. And the people will want to live for the 80s in the best way as possible they can do it. Of course that we have some problems in some other people in different ages where we proceed as in the exact way that you see before. But right now, with different design of implants. And of course we have the same results. And it means that it's a protocol that we can reproduce over the time. And again, we can change people's life just in a moment. And after 10 days, this human being is completely different than the one that came to our office, just because we do the right thing in the right way and in the right moment. That is called dentistry related to medicine. And of course, we combine this with technology. We have an amazing weapon to perform the right way and in the right place, everything. So as you can see, we do this with a lot of patients with the same result, with amazing response. So the question is, computer-guided implant surgery, it's precise. And if we compare to freehand, of course that we will have some errors in the entry and in the apex. But if we compare the worst result of the guided procedure, is more or less than the best in freehand. What means that? That you don't have to be very trained in implant installation to do it in the right way if you know the system through the digital workflow. But what is the problem with this amazing study? It is that we are compare apples with bananas, like we say in Chile. Digital dentistry have nothing to do with freehand dentistry. It's completely different. It's another word, it's something different. It's not comparable, it's better. That's it. If you want to do a study, do the study that you want and you will reach to the same result. It's better, it's always better. So what we have to do? We have to get immersed in this work. We have to start a different analysis and we have to look to the 3D printers. Are these printers good printers for digital surgery? And of course not. They are expensive toys. We have to go to the next level. There is like this, the Carbon M1, or of course the Stratasys Orthodesk, or something very similar or something like that. Because we need to avoid any risk. Rings. All this surgery is going through these rings that are different shapes, different design for different brands. And a concept that is called the offset. The offset is the distance between the upper surface of the implant and the upper surface of the ring. That distance is the offset. Some systems propose it like something variable, where it makes a mess to perform the surgery and to plan the surgery. It should be perfectly coordinated with the software, and sometimes you don't believe it that it's not coordinated, that you prepare something that don't fit. Amazing. Scoop is a reduction. What it means that the relation with the ring will be by a scoop and the burr will go through this scoop. The other concept is that the reduction will go immediately through the burr. Now we are comparing two systems that they are the same. Guided surgery through scoops or guided surgery through reduction burr. Now we are doing what we have to do. This is a comparison. It is a matter of gap and precision that we call tolerance. Now in the teamwork with Cortex that give me the chance to work with them, we start to think, to brainstorm, and to develop. What do we need to create to be more precise, to go into the digital world with the precision that we want? First, use the right implant that Meyer already explained. Second, use the right ring. And third, reduce the tolerance between these two elements to the minimum. Which is the problem? The problem is that we will produce heat, of course. And that is something that we have to be aware. So concept number one, with the reduction scope and without. What's going on here? Imagine that this is the guide and this is the bone. With the reduction scope, we have two gaps. With the reduction in the burr, we have only one gap. So two spaces against one space. That means that with two spaces, we will generate an angulation that is bigger than the one that we can have with only one space. And of course that if we increase this distance that we have been explained before, this angulation and this space, of course, that will be increased also in the same way. So, the gap concept and its consequences. With the scoop, two spaces, two gaps. Without, directly to the ring, there's only one gap. So how much we can reduce? We can reduce it until the full contact. But the problem is that we will produce temperature. We all know that when we have fever, and if we go up in the fever more or less by the 43 degrees, we are under risk with the organs of reproduction and some other things. If we go higher, we are in problems. For the bone, the way with no return is 47 degrees Celsius. So we start to create by drawing, and we sent this drawing to the engineer department that developed the relation about this burr with this ring in a different way. And the circumference of contact of the burr is not complete, like you see here. So the ring is here, the circumference is not complete, less than 50%. Make sure that it will rotate in the right way, and it creates something amazing for me. The new concept of burr that is flat and round, flat and round. Which is the benefit? The benefit is that we can drill, we can use it guided, of course. It will stop over the surface of the ring, and it will leave a space for reduce the heat. Very interesting. This is pure mechanical engineering concept. The ring, the burr, and the space. What is this? It's something that we as dentists, we don't know, of course. This is the trabological system. The trabological system have inputs and outputs. The inputs is load, motion, and speed. The outputs, friction, wear, and temperature change. Of course, if we increase the speed, we will increase the temperatures. If we increase the load, we will increase the temperature and the friction and the wear. Of course, these are disposable materials, so we don't care if there is wear. But we care about the temperature. Why? Because this is a closed system. Why is a closed system? By the moment that we are using a surgical stand, we will not let the water goes in. But in this system, because of the flat side, you can see how the water or the cooling system is going all the times inside the system, preventing from temperature raise. This is the complete circumference. This is the half circumference. Temperature raising. And if we put some cooling, it will be completely safe. And again, we as dentists, sometimes we don't understand some things, like the theoretical part of the mathematics, because the engineer can explain with numbers everything, but we will not understand because we are not trained for that. We are trained for biological environments. The biological environments is cause-effect, and we understand the things when we solve the problem and then when we solve the solution. So the formula to explain this is in the drive environment, because we are comparing design, engineering design, and it's 57% less heat production in a burr that don't have the complete circumference. How we can test this? Temperature cameras, 10 seconds, after 10 seconds of drilling, 1,300 RPM. We made 4 measures, one in the finger, one in the head of the handpiece, one in the burr, and one in the ring. And you can see in the measurements that the difference between this and that, it's completely different. And it's up to 50%. What it means that? It means that if we are not able to cool the system, we will produce more temperature than the temperature that we want to have in the bone. What if we go to the wet environment? For the wet environment, we create this surgical stand that will block the water. So the only way that the water goes inside the bone is through the burr, through the drilling process. So it's important to see, look, We place the bird to the end. It fits both sides, different systems. This is from Cortex, the concept with the open side and a complete close. Can you see how it gets in? Only it will get in to the bone when you separate it and you let it flow through. Also, you can see that here looks like it's more water, but it's the same motor, it's the same system. Because it creates bubbles because of the design of the bird. I don't know, but bubbles may add oxygen to the system. It's something that we have to investigate. What happened to our patients? Patients that we see everywhere, every day, every place, completely edentulous or partially edentulous, or will be completely edentulous in less than the time that we want. The problem, they will live for more than 30 years, and we need to give the solution in a proper way. This is the system, part of the system to create a model, which is this, the ring and some implant transfer to create with the surgical stent the model before start the surgery. So we have a reliable surgery and we have the model before we start. So it will be very easy because everything have the same distance, the same compensation between the software and of course between the surgery. So when we perform the surgery, we have already in our hand the prosthesis. And we can finish in the moment of finish the surgery with a temporary or a definitive. It's up to you. It's up to where you want to put the risk. In a few moments, Professor Borja will show you more clinical points of view about the surgery with nice pictures and of course videos. But you can see here the effect of the bird and the system, that even that you go all the way down, it will let the water goes in and also goes out the chips on bone and everything because of the design of the birds. And of course, if you prepare everything and if you do the right implant installation, then you will finish in the best way as possible, that is with the final or temporary prosthesis, as I said before. So this is our master trial patient. The upper jaw was made by scoops. The lower jaw was made without scoops, and you can see the difference in the superstructure, the misfits, because of the lack of precision produced by the gaps and the angulations. And of course, at the end of the day, what we care about is about our patients and how they feel about the procedure that we perform, and of course, how they face the life after implant treatment. Other thing is the planning of the smile and things like that. But for sure, we should be very happy. For the future, the game changers will be for sure the printers and the intraoral scanners. They will surprise us with much more. And the chaos theory is a popular wisdom that starts with the Lawrence butterfly. It says, the flapping of a butterfly wings in Brazil set off for tornado in Texas. He's had a lot of different quotes, but more or less it's the same. It's not a real butterfly, but it means that a little change in one place could create a big storm in some others. It was described by Edward Lawrence. In the same way, in the management and also in production chains and in production service, when you have a problem in the start point, then the problem at the end will be bigger and bigger and bigger. So when you plan in software, and if you have some little problems in the software, At the end of the day, in the surgery, you will have a big problem. If you're not able to identify it, or if the system is not the right system. We think that this system will give us the chance to be more secure and to give better treatments to our patients. Thank you very much for your attention. And I will call my friend